On this episode, we will talk about if everybody needs extra skin removal after their surgery. We'll also talk about if you need a passport to come down with us for surgery, and we'll talk about weight restrictions after your sleeve. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 189 of the AskDrA show. Thanks so much for sending us your questions, and if you're new to the show, you're more than welcome to send me your questions using the hashtag AskDrA throughout social media. That way we're able to grab those questions, line them up, and I'll be here to answer them. Also, if you're interested in weight loss surgery, if you're interested in gastric sleeve, you're curious, you're looking into it, or you've had weight loss surgery, go ahead and I would suggest you hit that subscribe button, and well, that way and if you hit that bell as well, you'll be notified every time we get a new video uploaded. All right, so let's go into the show. Okay, so the question is, does everybody that gets gastric sleeve, does everybody need extra skin surgery, extra skin removal? The answer is, of course not. Okay, so extra skin, not everybody gets it, and if you get some, not everybody needs to get that skin removed. And of course, there are some severe cases that really need that skin removed. We're talking about very high BMI patients that they've lost a lot of weight. I mean, I've had a patient that was initially 600 pounds, and he lost 400 pounds, and he's pretty much my weight right now, close to the 200-pound weight. So he did need extra skin removed. I'll give you the other example. We have a lower BMI patient, female, barely got into the criteria of getting weight loss surgery. She probably won't even need down the road. So there are some factors that do interfere with the results: how much exercise you do afterwards, how much weight you have initially to lose. Your genetics has a lot to do. Your age has a lot to do, because it's very different if you're 15 rather than 25, rather than 55, or rather than 65. So age has a lot to do as well. Hydration, very important, keeping your skin hydrated after surgery. Yourself hydrated, but your skin as well. So that gives the skin more elasticity as well. So these are factors that you might control or you might not control, because you don't control how old you are. That's just a fact. But you do control how much exercise you do afterwards, how much protein you intake afterwards, or how well you hydrate yourself or your skin. So back to the question, does everybody need extra skin removal after surgery? The answer is no. Okay, second question is, doctor, do I need a passport to get down to surgery with you? If you come to our center, the answer is no. You don't need any type of document to come into Mexico, since we do offer the door-to-door service and we go pick you up in San Antonio, or you're more than welcome to drive down to our center, to our hospital here. You won't need any documentation. They won't ask anything coming into Mexico. You would need some papers to get back to the States. A passport is not obligated at this point, but a birth certificate with a official photo ID, like a driver's license, that is very useful to get yourself back. But of course, if you have time and you get your passport, that's even faster, easier, and quicker. And this is a very good question. How much weight can I carry after surgery? I've got a very intense job. It requires for me to lift 50, 60, 70 pounds right after surgery. Can I do it? The answer is no. We give out a lifting restriction report that says you can't lift more than 5 pounds the first week and a 5-pound increment every week after. Truth is, that's more for legal purposes, for work. You can present at work. It justifies you not being able to carry heavy stuff. But truth is, I tell patients, the easy way to remember it is no more than 30 pounds the first 30 days. So easy enough. It's no more than 30 the first 30. I tell this a lot to patients that tell me, doctor, I've got a 1-year-old. He's 25 pounds. Can I lift him up? Yes. Be careful. Like a 1-year-old or a 2-year-old, you can easily tell them, get on the chair, get on the couch, and grab them from there. Try to avoid straining. Try to avoid lifting from the ground, or have somebody pass them to you. You can do that. So there are some ways, but the best way, is your particular case. See it with your surgeon. But an easy way to remember is no more than 30 the first 30. All right, so that is it for episode 189 of the Ask Dr. A Show. Thanks so much for joining us and sending us the questions. Don't forget to hit the like button. Helps me a lot. Appreciate it. And don't forget to subscribe to our channel. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.